World War I brought many changes that led to new advances in medicine and modern medical practices. Whether it was reformed cleanliness standards, new medicines, updated triage practices, or anesthetics, nurses and their medical officers did what it took to meet the needs of the soldiers. The importance of cleanliness and its association with reduced infection was a major step forward in saving lives. Considering the natural of soldiers' wounds were more prone to infection than those seen in a normal hospital, the infection was rampant. Bullet wounds and outdoor exposure combined with added hardship of not having antibiotics made for risky work. This was not a uniquely American experience. Russian medical professionals were known to soldiers with salt or iodide until the soldiers were able to access more stable treatment. Trench warfare. The medical staff also had to adapt to trench warfare and the alignments that came with it. Factors like proximity, water, dirt, and trench fever created the perfect recipe for sick soldiers. Soldiers go through foot inspections to monitor trench foot, a condition which constant dampness caused feet to swell and rot. Other cold-like symptoms caused by trench warfare were treated with dissolving gelatin pills. Blood transfusions were another relatively new source during this time, and various medicines were used in the care of the wound. Diagon solution, for example, was an antiseptic solution made using diluted boric acid and sodium hypochlorite. It was used to irrigate wounds before closure. Other medications include cocaine, hydrochloride, used as local anesthetic, and chloroform, used as both a general anesthetic in surgeries and sedative. For pain, some of the common painkillers or analgesics used at the time include sodium salicylate, elixir of opium, or morphine sulfite. Triage was another developing facet important to medical strategies nurses carried out. While the process of triage was introduced decades before, nurses became much more systematic in their approach. Tactics varied by country, but British soldiers created a three-part system to categorize soldiers into degrees. 1. Wounded soldiers requiring minimal care before returning to the front lines. 2. More serious injured soldiers in need of hospital attention, and soldiers expected to not live despite medical treatment. Before soldiers even reached hospitals where triage took over, however, there was a multi-step process to get them from the battlefield to the hospital bed. First, they would be taken on a stretcher to a regiment aid post, then a monitor ambulance would take them to a casualty clearing station, and from there, a hospital train would take them to a base hospital.
U.S. Army nurses were only U.S. citizens, female, unmarried, between the ages of 25 and 35, Caucasian, and graduates of training schools. However, by the end of the war, there were less restrictions. According to the United States Army, the Army Nurse Corps has around 403 active nurses and 170 nurses in the reserves. The Navy Nurse Corps also had 160 active nurses. 1 month after the U.S. joined the war, overseas nurses were sent to Europe. The number of nurses rose as women enlisted by the thousands. By the last year of the war, there were approximately 12,000 active nurses from the Army Nurse Corps. There were only 1,400 nurses in the Navy Nurse Corps by the last year of the war. By November 11, 1918, there were 21,480 nurses enlisted. More than 10,000 of them were serving overseas in places like France, Belgium, England, Siberia, Italy, Serbia, Hawaii, Puerto Rico, and the Philippines. Nurses treated patients near or right behind the front lines at field hospitals, evacuation stations, or clearinghouses. They even used some churches that were turned into hospitals. They treated infections, wounds, and mustard gas burns. They also dealt with soldiers' emotional problems like shell shock. Nurses had to deal with long hours, extreme cold, and poor weather conditions. They also had little equipment to treat the wounds of soldiers. A huge problem that nurses and everyone else faced was an epidemic of the flu. Due to this flu, over 200 Army nurses died while in service, and 36 Navy nurses also died. Nurses weren't well respected and treated like other officers. This caused their orders to not be accepted, usually by other medics.
Medical Association of the American College of Surgeons formed a community on medical preparedness. Frank H. Martin, head of the American College of Surgeons, were particularly instrumental in recruiting surgeons and medical received call of the war. The National Academy of Science created a Nation Research Council, which became an Army of Nation Defense Council. Universities such as Johns Hopkins University of Kansas and Harvard University were organized in the field hospital units, operating under overall control by the Army. The Red Cross was a time of organization that proven ambulance and deliver medical care. Besides the relief actives was a great assistance. It has been involved in the war since 1916, proving its 47 ambulance unit to assist the British and French Army. All of these units were taken into the Army after the war was declared.